You're tuned into the Community Hour with me, Alina, and on the line with us now we have Shaheen from P&S Chemist. Hi Shaheen, how are you?
Hello, yes, I'm fine, thank you. What about you?
Oh, I'm great, thanks. Thanks for talking to us at NuSound Radio today.
Yeah, thank you for having me.
It's no problem. Firstly, I'd like to congratulate you on P&S Chemist's 25th anniversary. That is a great achievement.
Thank you. As I said, it's the work of my fantastic team here, as well as the local community who's supported us throughout the years.
So tell us about your 25th anniversary day. What are you going to be offering on the date to celebrate?
Right, on the day, which is the 5th of July, Thursday next week, we're actually offering free blood sugar testing for diabetes, free blood pressure testing, and free carbon monoxide testing for smokers. Basically, it's like even for the smokers, who are not aware about what carbon monoxide is a lethal gas. You can't see it, you can't smell it, but they do inhale it every time they smoke. But we have monitors that can actually check for that, so they can see for themselves. So whether they decide to give up or not, they're able to sort of have a look on a meter and see what kind of levels they've got in their lungs at any particular time.
And how do you test for that? Just by breathing into a machine or something like that?
Yes, that's right. Yeah, you just have a device and they breathe through it, and then we're able to show on a chart, whether they're sort of very low levels or very dangerous levels. But the beauty of it is that even if people only smoke maybe 1 or 2 cigarettes, we're able to show them, that it still has a significant impact on their lungs from those cigarettes.
Okay. And as you said, one of the other services you'll be offering is free diabetes sugar testing as well as blood pressure testing. Why have you decided to offer these particular services for free on the day?
Right, well, diabetes is a disease that is continuing to rise every year. It is a major disease problem for the country, and heart disease as well is, I don't know if you're aware, it's actually the biggest killer in this country, heart disease in general. And people who've got diabetes are actually prone to getting heart disease at the same time. The incidence of diabetes in Asian people is at least 4 times greater than it is in the general population. So we need to bring awareness to those people, because if they can find out early enough about these diseases, they can actually maybe prolong their lives maybe by 10 years or even 20 years, or longer. And they can sort of live longer, healthier lives, by taking the right precautions much earlier.
So that's, of course, a very valuable service by the sounds of it.
Yeah.
And obviously, you also offer a free non-stop smoking service as well. What does that involve, and how does someone get it?
Right, it is a free service, and again, as I said, a lot of the community doesn't necessarily appreciate that. We offer a 12-week one-to-one service. All of the nicotine replacement products that you can normally buy, so that's things like patches, gum, the new mints, and so on. All of those are available on the service. So if you was, say, even if you were paying for them, like, you're not exempt on prescription, every 2 weeks supply will only cost you the prescription item, which is $7.65, whereas normally you would be paying between £80 to £20 for 1 week's supply of product. And on top of that, you would actually get a one-to-one, interview and session with the person who works with you and supports you throughout the 12 weeks.
Okay, so it's a lot cheaper, it's very personal, and it's one-to-one, which is, of course, very helpful when you're trying to stop smoking.
Yes, of course, and I think the beauty of trying to get it through your pharmacy anyway is that it's not like an appointment system where you can't get through to your GPs necessarily. You can tailor it around yourself, tailor it before work, after work, whatever's convenient.
That's actually a very good thing, because a lot of the time people always talk about how they're going to do it, but then they make excuses, how they don't have the time, how it's not convenient. So that's a very, very good thing to hear that you can tailor it around yourself.
Yeah, and then, I think sometimes, obviously, partners do sometimes push maybe, one of the partners who is smoking. But I think, people themselves, they need to come down, they need to have that sort of initial motivation to do it for themselves. And the only way they can do it is to get more information. So if they come in and, and this is what we say, we're not forcing anyone to give up. What we'll do is initially provide the information and, sort of let you know, let you see for yourself, say, your carbon monoxide result in far as your lungs are concerned, remind you that it's just one of thousands of chemicals in one cigarette. The fact that it's one of the, again, the smoking leads to, cancer and a variety of heart diseases. And it's a preventable disease. So you have to ask yourself then, why do I want to do this? And that's the beauty, as I said, of sitting down with someone who's actually got time to talk to you.
That is very good. So you provide all the information that people need before and help them make an informed decision.
That's right, yes.
And then, of course, help them through the process if they do decide to quit.
Yes, that's right.
Oh, that's brilliant. And as well as these services, there's a lot more. And included in that, I know that you have a sexual health service as well. What exactly does that include?
Right. It's a sort of an overall umbrella, actually, for a variety of services. It was initiated initially, actually, to sort of help tackle teenage pregnancies, which were on the increase in Redbridge. But, again, especially the Asian community, again, they get a bit cautious about such things because they seem to assume that, we're trying to sort of promote sexual relationships in general, and that's not the idea of it. The idea is that women and men, in fact, they all need to get advice on sexual health, and you could be married and you still need advice. So we offer free pregnancy testing for under 25s. We do provide the morning after pill, but it's done under consultation, so it's on a one-to-one basis. It's not a case of you going to the counter and buying it. It's not as simple as that. So because there's a lot of advice has to go with that supply, we do discuss the fact that they should get themselves tested for sexually transmitted infections, and of course that's again is a very important aspect with any new partner that you might encounter, because in teenagers, again, the incidence of, say, chlamydia and gonorrhea is very, very high. And it's only when they start having the screening done do they realise that these things happen. So, it's the best way to get help and advice. And it's totally discreet and confidential. So, if they do come in and ask us for advice on such things, it's something that we do not discuss with anyone else or say their parents if they don't wish that to be discussed, or nothing goes to their home address.
That is very good. Of course, it's all very discreet and private because, of course, a lot of people don't want anyone else finding out about things. A lot of people don't know who to turn to. So it's great that you are offering advice as well as all the services that you have mentioned.
Yes, that's right. And I just still want to make the point that we are making a big thing on the day next Thursday about getting people in to be tested for obviously blood sugar and blood pressure. And there was a recent audit actually that there are still about 24,000 deaths every year in England from diabetes, which in fact can be avoided, and apparently the reason is because there's not enough screening going on. So even with people who have got diabetes or have already been diagnosed, because they don't understand their conditions properly, they're not monitoring it, they're not following the right medication advice or diet advice or lifestyle, they're still putting themselves in danger. So again, we want to let everybody know that we're here to actually help you understand your condition, help you monitor it. And again, once you've got diabetes, you don't have to think, well, this is it, then, I'm already on sort of a fatal road. You can still actually live a very long, healthy life.
Okay. So you will be providing a lot of information as well as testing and things like that as well.
That's right, yes.
Okay. And obviously in the 25 years that you've been running P&S Chemist, you mentioned that you've piloted some schemes in the community as well. Could you tell us a bit about the schemes that you have piloted?
Yes, well, we was one of the pharmacies involved in the provision of the morning after pill, because at that time, in fact, only girls over 18 could buy it over the counter. So we had to sort of make it where they could access it, as I said, in a confidential environment. So we helped to pilot that. We've also done a lot of work with our local drug and alcohol clinics to help people who are having drug problems. And again, it's a very discreet service. It's an area of the population that, again, people don't necessarily want to discuss because they think that if those people are tending to use drugs, then it's their own problem. But our attitude is here that we don't make judgments on all of the populations, whether you fall into it by accident or otherwise. Those people are still, they are not well and they need help. So if they want to come to somebody to talk about it, we are happy to do that. And then, we signpost them to the relevant clinics where they can get help. I do actually get senior family members sometimes who obviously get very stressed and depressed about such things because they're not sure who to turn to, and it's considered to be a stigma if someone in their family is taking drugs, and and they don't know who to turn to. So obviously we say help is available there.
Okay. That, of course, is very good to know as well for any families that might have anyone in the family with drug problems, that you are there to help.
Yes, that's right, yes.
Okay, and finally, obviously you've been in business for 25 years. How has the chemist business changed over the years, and how has the clientele changed? Tell us a bit about how it's all developed and changed in the last 25 years.
Very radically. We now probably do a lot more one-to-one services than we ever did. That's increased a lot in the last 5 to 10 years. And that is a good thing, as I said, for all of the patients, the fact that we now sit down and give them very detailed consultations on how to use their medicines, how to make sure that they're not having any side effects, or when they start new medicines, there are services for that to monitor them as well. And as I said, I think people are accessing us more and more, even with schemes such as minor ailment schemes, which I haven't mentioned before, but those are sort of minor conditions that people can come to us and we actually prescribe from the pharmacy rather than them having to go to the GP for that. A lot of, as I said, service aspect has changed quite a bit. We are not really sort of just dispensers of prescriptions. People should sort of view us as the first health access point to talk about their health. We're going to be there, as I said, I think, in the trying to help people prevent long-term diseases like diabetes and heart disease.
That is always very useful because, of course, sometimes it is a bit hard to get an appointment with your GP. Sometimes it's a bit hard to find the time or the space. So it always is good to know that there's another point of call that you can go to that can provide a lot of the same services as well, and a lot more advice and things like that as well.
Yeah, there's certainly. And then obviously, again, where people are travelling a lot more, I think they did, well over 10, 15 years ago, people need to also come in and get advice about vaccines, malarials and so on, and that's more important than ever because obviously infection and malaria is very rife throughout the world, and they should take precautions before they travel and get advice from the pharmacist.
Okay. Well, thanks very much for talking to me on NuSound today, and I wish you all the best with your 25th anniversary day. If people want to come down, that's on the 5th of July, is that correct?
That's right, yes, from 10 in the morning till 4:30. So a whole load of free testing, might be some goodies on the day as well.
Oh,
so
brilliant.
Please do come along and see us.
And that's at 111 Ilford Lane, is that right?
That's right, yes.
Okay, well, I wish you all the best of luck on the day, and thank you very much for talking to us today.
Okay, thank you.
Bye.
Right, take care. Bye.